Hello everybody, this is Dr. Ed Plentz from the PAC, the Plentz Academy of Chiropractic. And what I want to review today in this video is how to give proper recommendations. We want to give you a scientific validation with recommendations along with some practical application. So when you get done with your report of findings, your patient can feel confidence in the recommendations that you provide for them. So I base my recommendations on two things. First is the orthopedic fact on how a weight-bearing joint functions and heals. Now, what I mean by a weight-bearing joint is an ankle, a knee, a hip, or a spinal joint, something that we stand or sit to oppose gravity with. Not like a wrist, an elbow, or a shoulder. Those are more hanging and hinge joints. They don't take as long to heal because we're not standing on them all the time. But a joint that bears weight takes a minimum of 12 to 16 weeks to heal. Now, that's kind of known in all the healing arts. That's why physical therapy is 12 weeks, orthopedic rehab is 12 weeks. But here's what they don't tell you. That joint will heal in no matter what. And I've done it, and my patients have done it too. We get injured, and in 12 to 16 weeks, that thing will heal, but healing wrong. And when it heals in wrong, every time the weather changes, especially like living in where we live in Michigan, or you just turn just right, or maybe you stress yourself, you feel those old injuries. So let's give you some practical ways to be able to give proper recommendations for your patients. Now, we talked in previous videos, we talked about doing the exam, and we do a complete objective exam. Then we take x-rays to find out what phase placement the person is in. So I'm going to give you a phase placement recommendation. So we know orthopedically they're real sound that it takes 12 to 16 weeks. So instead of 16 weeks, we're going to pick 12 weeks. So condition-based care is 12. Corrective care is 12. And even when a person's coming in under wellness care with no symptoms at all, every 12 weeks we're doing a re-exam to find the objective findings because we're not really worried about symptoms at that time. But let's go back to condition-based care because this is what most of you are going to deal with in your first visits with your patients. So if a person is in phase 1, that means they have visible misalignment, subluxation obviously, but with no arthritic changes. We're going to take that 12 weeks, we're going to break it up into 2 6-week blocks because they're phase 1. They have less scar tissue in there than someone phase 2 or phase 3. So in phase 1, that scar tissue has been there from birth to 20 years, okay? And we're going to break it up in 2 6-week blocks. So we're going to go 3 times a week for the first 6 weeks, and then twice a week for the second 6 weeks. Now, we're real sound on the 12 weeks, that's for sure. The visit frequency is a little bit more theoretical, all right? Because even as long as I've been in practice 27 years, I study the body every single day. Got almost 2 million adjustments on my hands. And even with all that experience, it's hard for me to look a person in the eye and tell them exactly how many visits they need. So this is a guideline for them. So it may change as it goes, depending on how they're responding or not responding to care. A person who's in phase 2, that means they have visible misalignment, they have disc degeneration along with visible arthritic changes. Now you're looking at degeneration show up on conventional x-ray who've been there for 20 to 40 years. Or an impact so hard, if they're not 20 to 40 yet, that it accelerated the process that fast. So their visit frequency, still going to be 12 weeks. We're going to break their care into 2 different blocks of care, an 8-week block and a 4-week block. They're going to go 3 times a week for 8 weeks, then twice a week for 4. Again, visit frequency, a little bit theoretical. It could be more or less depending on how the patient is responding. Kind of makes sense that someone in phase 2 would need a little bit more upfront care than someone in phase 1 or near normal because they have less scar tissue, or I like to say rust on the bolt, as to say. They just have less degeneration in there. So phase 3 or above, we're starting to get pretty far gone. Phase 3 is that we have partial fusion with still some disc space. So what we're going to do with those patients, both phase 3 and 4, is they're going to go 3 times a week for 12 weeks. The reason being is phase 3, you're looking at 40 to 60 years worth of degeneration. And phase 4, to be a complete clinical phase 4, where they're fused naturally, is to say, you're looking at over 60 years. So 12 weeks is barely enough to scratch the surface to really start to combat that care. But the body's so amazing that in 12 weeks, we can get some amazing stabilization and give them a re-exam to then graduate them into corrective care and wellness care effectively. So I hope this helps you to understand that there is a scientific protocol to be able to do that and that you can be confident in your recommendations now.